Bordetella pertussis is a gram-negative coccobacillus, as seen here in its gram stain. It looks kind of like little pinky orange footballs. It does occur singularly, although it does sometimes occur in pairs, as you can see in several spots here. It has a capsule, and it has a flagella-like structure, which lets it move on its own. They didn't think that it could do that, but recently they have discovered that it can. It is aerobic, meaning it requires oxygen to grow. It's non-fermenting, so it can't metabolize glucose. And it's nutritionally fastidious, which means it requires special nutrient-rich agar to grow in the lab. So it was first grown on Bordetella agar. It's named that after the men who first isolated Bordetella pertussis. That contains blood, potato starch, glycerol, and an antibiotic like penicillin or cephalexin. Now it's usually grown on Reagan low agar, which has blood, charcoal, and an antibiotic, or it'll be grown on synthetic agar. As you can see here, the colonies are off-white, they're round, they're raised, they're very slimy, indicating its capsule, which indicates it is highly pathogenic, and it is the causative agent of pertussis, more commonly known as whooping cough. So Bordetella pertussis was first discovered by Jules Bordet and Octave Janjou in 1906. It primarily infects humans, although sometimes it does infect higher primates like gorillas. It actually has been known to infect them in zoos and in wild gorillas as well. So they tend to vaccinate gorillas in zoos against this. Its ideal temperature range is 35 to 37 degrees Celsius, and its ideal pH is 7, which is interesting because humans have an ideal temperature range of about 36.5 to 37.5 degrees Celsius, and a pH is 7.4, so that shows why it grows so well in humans. It is spread by airborne droplets, so you have to be very careful not to spread it while working with it in a lab. And the infection itself has about 3 stages. The first is the incubation period. It's not one of the stages, it's the beginning of the infection, but you don't have symptoms yet. It lasts about 7 to 10 days. Next is the catarrhal stage, which is named that because of the inflammation it causes in the nasopharyngeal region. It lasts about 10 days, and it has very mild symptoms. It's often confused for the common cold. Like, it causes very mild fever, sneezing, runny nose, and a very light cough. As that cough begins to worsen, especially at night, the infection moves into the paroxysmal stage. That lasts about 1 to 6 weeks, but it can last 10 or more weeks, which is why it's known in some countries as the 100-day cough. It causes extreme coughing fits called paroxysms, and they're so severe they commonly cause things like severe lethargy or tiredness after the coughing, vomiting, urinary incontinence. It can cause nosebleeds and the bursting of blood vessels in the eyes. You can even break ribs with the coughing. Infants in this stage usually don't have the cough itself. They usually go through periods of not breathing called apnea instead. The reason it gets the name whooping cough is because in this stage, as your lungs empty with air, as you need to breathe in after they've emptied with the coughing, it's a gasp or a whooping noise. It's a very sharp noise. Then the third stage is the convalescent stage, and that can last months. That's the recovery period, while you're still coughing, but it's lessening, and your breathing is getting better. So these are also called the colonization and toxemic stages, based on what the bacteria is doing in your body. So the initial inhalation of the bacteria, it attaches to the epithelial cells in the nasopharyngeal region, and this can extend into the lungs in babies. The surface proteins of Bordetella pertussis allow it to attach, and then it begins multiplying. Then, in the toxemic stage, you have something called tracheal cytotoxin produced. That paralyzes the mucociliary elevator, which is the way your lungs use the cilia lining them to move debris and mucus trapped in the lungs up through the throat to expel it. This paralyzes that, so you're not able to do so. It also produces something called pertussis toxin, and this is responsible for lymphocytosis. That's an increased production of lymphocytes, a type of white blood cell. This can cause pulmonary hypertension, which is the increased arterial blood pressure in your lungs. That is responsible for many of the cases of death with this disease. Infants sometimes also suffer from encephalopathy, cerebral hemorrhaging, things like that during this stage. During the colonization stage, if you do a swab in the nose and back of the throat, you'll tend to get a good culture. You'll get a lot of the organism back, and you can treat it pretty successfully with antibiotics. However, once it gets into the toxemic stage, you're not going to be able to get a good colony growth from a swab anymore, and antibiotics no longer treat it. So to diagnose pertussis, first your doctor is going to evaluate your symptoms and see if they indicate the presence of Bordetella pertussis. In this case, the symptoms would be things like the extreme coughing with, the vomiting, the lethargy, the urinary incontinence, and the fever. If those are present and it indicates that you are suffering from pertussis or whooping cough, you'll likely do a nasopharyngeal swab, as seen here, indicated in this picture. They'll just swab that region because that's where it grows the best, and they'll run that out and they'll culture it on a plate and see what grows, and if it grows, they'll treat it. PCR can also be used, and once you get past that 3rd week of the cough, a swab is not going to grow bacteria anymore. So the PCR is the only diagnostic tool at that point. To treat pertussis, you use antibiotics, typically a macrolide, as seen here. That'll usually be erythromycin, azithromycin, or clarithromycin. This is only useful if you have not had the cough longer than 3 weeks. If you have and you are an infant older than 1 year of age, or if you're older than 1 year of age, you won't be treated past 3 weeks because it's not going to shorten the severity or the duration of it at that point, and you're not infectious anymore, so it's not going to prevent the spread of anything. If you're pregnant or you're younger than a year old, you will likely still be treated if you come in showing the cough and it's been less than 6 weeks. And they have found that the earlier the treatment is started, the more likely using azithromycin for about 3 to 5 days is going to be just as effective as erythromycin for about 2 weeks, and that lessens the antibiotic side effects you also have to deal with during the infection. Currently, there's no treatment for the paroxysms, the coughing. There's no treatment for it, and over-the-counter cough medicines have not proven to be effective, so it's usually discouraged to use those in cases of this. You can, however, typically prevent pertussis with a vaccine. Everyone should receive it at any age. Vaccine production began as soon as Bordetella pertussis was ID'd in 1906. And Louis Sauer in the 1920s created a very weak version of the vaccine, a whole cell version. That is one of the earliest versions of the pertussis vaccine. Leila Denmark in 1932 did research and developed a really effective vaccine after an outbreak in Georgia. And then Grace Eldering, Pearl Kendrick, and Lonnie Gordon took her research and their own research on the vaccine and combined it with the diphtheria and tetanus toxoids to make the DTP vaccine, which was the first combination vaccine for pertussis in 1942. After the invention of this vaccine, rates started dropping rapidly. In the 1980s, in Japan, there was a man who developed, his name was Sato. He developed a cellular version of the vaccine, and that lessened the side effects you would get from the vaccine. And soon that was adopted worldwide, and that's why we now have DTaP and Tdap. Those are the current vaccines used. Epidemiology, there are about 16 million cases seen every year. Mainly about 90% are seen in developing countries. There's about 61,000 deaths associated with it. But as you can see, there have been many recent epidemics. Between the 1940s and 1980s, cases were falling dramatically, but they've started to rise again. As you can see, there have been several recent epidemics. In the U.S., there were about 40,000 cases in 2012. I think one of the more recent numbers is 21,000 in 2015. And pertussis remains one of the most vaccine-preventable deaths worldwide. So that's really about it.